So, is a healthcare deal finally on the horizon? Health Minister Jean-Yves Duclos appeared to change his tune today after suggesting earlier this week it would take a lot of work to reach a deal. And while all eyes are on the feds and the premiers to come together on a deal, a plan from Ontario sparked new debate about the way forward. Earlier this week, Premier Doug Ford released a new three-step plan to reduce surgery wait times. Over 200,000 people in Ontario are waiting for surgical procedures, according to the province. The government says its plan, which includes investing in private facilities, will cut down that backlog. The plan has been called innovative by Justin Trudeau and an attack on universal health care by Jagmeet Singh. But what do the people working in Canadian healthcare think? We're going to talk to two doctors. Our first guest is on board with Doug Ford's plan. Let's find out why. Joining me now is Dr. Brian Day. He's the medical director of Cambie Surgery Centre in Vancouver. He's also a former president of the Canadian Medical Association. Hi, doctor. Thank you for making the time. It's good to have you on the show.
Oh, you're welcome.
You say it seems counterintuitive, but Premier Ford's plan will alleviate the shortage of doctors and nurses. Can you explain how you see that plan?
Well, it certainly will. And by the way, I don't like this private versus public because the rest of the world shows they can work together. But the reason it will help is that, first of all, private facilities are built and constructed without taxpayer funding. They generate, if they do make a profit, they generate taxes for all, unlike public facilities, for all three levels of government, and they add capacity. We know there's nothing new about what Premier Ford is doing because the NDP government in British Columbia started this over 30 years ago. We know from experience, not from theory, that, for instance, in the case of our clinic, we have about close to 80 surgeons, visiting surgeons. 23 of them would not be in Canada if it were not for the added operating time that we offer them. And in terms of nurses, if you look at the OECD data, Canada does not have a shortage of nurses. It's just that they don't want to work in the public system because it's toxic. And for instance, in Detroit, just across the border, there are over 1,000 in one district. In Detroit, there are over 1,000 Canadian Ontario nurses, and I think this will bring them back. So it will add capacity.
Explain to those people who are listening to us now, how would this give surgeons more operating time?
Well, because right now the operating time is rationed by the public system. So a surgeon in orthopedics, for instance, who in BC, they get about 5 hours, 6 hours of operating time a week. The Canadian Orthopedic Association has stated you need at least 13 and a half hours a week, even to maintain competence. When we started our clinic, I had progressively had my OR time in the public system cut from 22 hours a week down to 5 hours a week. And yet I had 400 patients waiting to get into hospital. Because of the rationed access and the rationed system that Canada operates under, and we're unique in the OECD in doing that, patients are perceived to consume the hospital's revenue. And what the rest of the OECD does is they have the funds follow the patient, even public funds.
Okay. Before I let you go, Dr. Day, I want to know the biggest warning is the risk for patient safety, when profit becomes a focus. What do you say to that?
The data shows the exact opposite. So, for instance, if you look at the data on complications in the public system, they are almost 40 times that in clinics like ours. If you look at there are hundreds, for every 100 admissions to a hospital, there is one unnecessary death in the public system. In over 80,000 patients treated at Cambie at our center since 1996, we have not had one death. So this actually will save lives, it will reduce complications, and it is good for the public in every way. And the evidence and the data
Well,
show that. It doesn't matter what the theories say. That's the evidence. And the
well,
rest of the world has already learned this lesson.
Well, at least here in Canada, Dr. Day will actually talking about it, which I think is a great improvement. Thank you for your time, Dr. Brian Day from the Cambie Surgery Center in British Columbia. Thank you so much for taking the time.
You're welcome.